We are on the third workshop, or it says second, but it's third. It's the next week we have the last one. And the first workshop, we discuss the problems of the perspective of the public healthcare system on the digital complex care management. And they brought their perspective, what they consider the challenges for the digital transformation. And after that, we had the second workshop that we had an opportunity to listen from the research institutions, what they are the main projects on this that could contribute to promote the digital transformation on complex care management. And today we are bringing the perspective of providers that work on the private healthcare system mainly, but what are their challenges and how do they see how they can contribute to promote the digital transformation of the public healthcare system, and they can bring the experience, and also how they can see how they'd like to have some collaboration from the research institutions. So this is the proposal for this workshop. So this is the first part of our workshop, and we have the experience from 3 Brazilian providers, service providers. 2 of them are healthcare management providers, but the third one, the Laços de Saúde, and I welcome Dr. Marta de Oliveira. Is a new participant, and she will have the opportunity to introduce herself. And also Auditari and Med, they are going to bring the experience, what they are facing on the private healthcare system. And so this is the first part of the workshop. On the second part, we are going to discuss the proposed challenges. We have a previous work on mapping the challenges from the perspective of the participants and how they would like to start collaboration with other partners. So Dr. Maria Lima will provide us the big picture of the collaboration already proposed by the participants. And the next part of the workshop, we are going to propose some goals, to continue this collaboration, and to conclude on the next week, on the last workshop, if we are going to work on a common project and what we are going to do together. Okay. So I hope you can enjoy this workshop, and right away I'll start discussing the first panel, as I said. So for this panel, we have the contribution, and I thank each one of them, Auditari, Laços de Saúde, and Med for their collaboration, for the time they provided for working to bring their experience and contribute with our common understanding. And so before they can present what they want to say, I brought some slides to better explain for our partners from Spain, Manuel and Adolfo, something about the Brazilian healthcare system. Most of them is already known by Manuel, that is a friend that is always coming here, he's a collaborator. But for Adolfo, I think that it's wise to see something. So the Brazilian healthcare system is divided in 2 parts. There is a public healthcare system called the Unified Healthcare System. It's free system, and it covers around 75% of the Brazilian population, and it's completely free. It's quite like the Spanish public healthcare system, and I would say they are quite close to the way it works. And but there is also a private healthcare system, and this private healthcare system it covers about 24 0.7% of the population, and in numbers 45 millions. And there is part of this private healthcare system that's called the supplementary healthcare system that's regulated by the National Agency of Supplementary Health. And there is one of the participants, Dr. Marta Oliveira, was a director of one of the area in this agency, and she can bring more understanding if she wants to bring more explanation. So those regulated part of the private healthcare system, the companies, they are not so free to offer the coverage they want to make. So most of the coverage is dictated by this agency. So it's not so free to establish a healthcare system. So it's a characteristic of the private healthcare system in Brazil. Okay, so there are two healthcare systems, the private and the public, and part of the private is regulated by a national agency. And what this private healthcare system is facing, what are the challenges? The first one is for this headline of this news that says that the Brazilians spend twice more related to the internal product than other developed country. So it's something really strange. We are a poorer country than the developed one, but we spend double, almost two times more than the other country. And in the public healthcare system is the opposite. The money that the government spent is half of that is usually spent on other countries. So it's a contradiction that exists in Brazil. And this cost for the healthcare system, the companies that most of them pay for the healthcare that for the workers, and they are complaining about the costs. The costs are rising, so they are starting to try to find new alternatives to provide care for their employees. But the other side, the companies that provide healthcare, private healthcare, they are complaining because their costs are also rising so much, and the people is demanding for more care. So it's a huge problem in this healthcare system, private healthcare system, and we believe that's why we are going to discuss in this panel. That we believe that complex healthcare management is something really important to tackle this challenge of this healthcare system, and mainly digital complex healthcare management, because we live in a new era of transformation. And if consider that 5% of the population demands 50% of the total healthcare costs, focusing at this population is an effective solution to improve quality of care, at the same time reduce the costs. Okay, so our participants, they are going to present themselves, say something about the company and what is the most complex care challenge they have in complex care, what's the most important challenge in complex care management, and the solution they are offering to the market, and the solution in the product. What are the special characteristics of the solution they provide? And the next part, they are going to propose some, what they think that they would like to do that's worthy for the public healthcare system to do as well, okay? And they'll propose us how they would like to work with us on this partnership model on a project that can be proposed in the context of this initiative, okay? So this is what they are doing. I asked them to bring some kind of pitch of this presentation, and they will have about, initially was estimated 6 minutes, but we can extend it to until 10 minutes, not more than that, for each company to provide the challenge. So I welcome Cláudia and Isabel from Auditare, Marta Oliveira from Laços de Saúde, and Gilson Bastos from MED to present their perspective on this challenge, okay? So I will stop sharing, and so they can share their presentation to us. The first one will be Auditare. It's alphabetical order.